We're just waiting for. Good afternoon. Good afternoon. Again, we'll be starting momentarily. Just waiting for a few folks to enter the room. Thank you for your patience. Good afternoon. Good afternoon. Good afternoon. Thank you for joining us. Thank you for joining us today. We're going to go ahead and get started in the interest of time and respecting everyone's time. My name is Tamla Milan Alexander, and I am the Strategic Partnership Liaison here at EverThrive, Illinois. I'm going to be joined by my colleagues this afternoon, Haley Steele, who's our Birth Equity Manager, and Elizabeth Gonzalez, who is our Associate Director of Birth Equity. Don't mind me, the fog outside is fogging up my brain a little bit today. What happened to summer at this point? Okay, it's battling with spring. Okay, so here at EverThrive, Illinois, we represent champions for health equity. Our mission here for EverThrive, Illinois is to achieve reproductive justice in the healthcare ecosystem through community-driven partnership, policy action, and systems change. Our vision is a just and affirming healthcare ecosystem where individuals, families, and communities can thrive. And our values are based in reproductive justice, anti-racism, centering the most impacted, and bold and transformative bold action and transformation. So often we have understood that having and raising a family should be a human right, but we know that not all families have the same opportunities to access resources so that they can thrive and support their own families. Next slide, please. One of the things that came out of our birth equity work, especially around the gathering, and for those of you who are not familiar with our work on the gathering was a tool that we came up with after doing sessions throughout the Chicagoland area amongst many communities that, of course, are suffering from inadequate resources. And so we developed the gathering as a digital public education campaign to help Black pregnant people in particular and their communities understand how to care for themselves during pregnancy and really identify and respond to bias in their care. And the tool has been distributed. We have boots on the ground. Through our outreach workers, we've reached more than 40,000 Black women of childbearing age across Chicago. And because of that, we said, wow, wouldn't it be awesome if we're able to really think about how we can share this across the state? And so what we did was ended up doing our listening sessions. And our birth equity listening sessions, again, the purpose was not just to think about collaborating with just the families, but to bring more of our medical professionals, our social service providers, and community members in to discuss how maternal and child health services are navigated in Illinois. We always talk about, well, we have all of these different resources, but how folks navigate it is usually a big barrier to care. And we've saw a lot of that through our discussions. And again, those barriers to service and care really was important because we had this awesome, again, opportunity to travel as a team across the state to do that. And so the goal of all of this is to really better understand how social determinants of health and systemic issues are impacting the parents from Chicago to East St. Louis. And so we also be sharing some of that, our one pager, which we developed from our listening sessions, with rich and informative feedback from families and supporters. We did our birth equity listening sessions between October 2023 and June 2024. We had over 35 community members in 63 community-based organizations, and some of the locations where we were able to do this. And I see some friends on the line who hosted us. Thank you, guys. We appreciate all your support in that, but we were in McLean, Champaign, Madison, and Williamson counties, and of course, the city of Chicago. And again, we all know that it should be a fundamental right to have children and raise them and do that where you feel safe and supported. And so again, this is an opportunity to think about how folks have to navigate and really what we heard, which for some of you may be preaching to the choir, but we also, again, through these rich and vibrant conversations that we had across the state, we found many commonalities, but we also saw some differences based on region and opportunity. Next slide, please.
Indeed, listen.
I'm sorry, did somebody?
Thank you, Tam. Yes, if everyone who's joining the call, please remember to mute yourselves, please, so that everyone can hear the presentation today.
And thank you. And with that, I'll turn over this portion of the webinar to talk with you all about our key barriers and lived experience that we heard from the participants through the listening sessions. With that, I'll switch it over.
Awesome. Perfect. Thank you. Yeah, so we'll go ahead and dive into the key barriers and some of the lived experiences that we heard from folks throughout the state. Particularly, we divvied up, so we created this one pager, right? And so these are some of the things we pulled from that one pager that we'll be able to share with you all. And so the theme here with this one, with our first one here, is standard of care and their experiences with the hospital system. So at the top, that is basically like what we've, what we heard from, generally what we heard from our community members. Sorry, just still letting folks in. So patients did report just negative experiences with their providers and some hospital systems, leading patients to feel really distrustful with their clinical providers, preventing them from seeking any further medical care. And patients did describe their clinical setting as not a true safe space for them. And these were oftentimes explained just with by limited capacity of clinical staff, lack of clinical staff training, and some communication issues. Some of the themes that we've heard from just some examples of like their lived experiences with this category. Folks felt judged based on their appearance or their marital status. Doulas were not allowed in the birthing space, or they were treated poorly. We also heard that language is overly medical and not compassionate and personal. So just the language that was used, folks either didn't understand or felt like their provider was just not explaining it to them in a way that they fully understood. And again, there was distrust in the hospital after a traumatic birth experience, and there was poor follow-up by medical or social service providers, and they also felt ignored by their providers. The next theme is service provider collaboration. So representatives from community-based organizations experience a lack of connection and awareness to one another, specifically with community-based organizations that do similar work or related work, right? We do know that families oftentimes have, a lot of resources that are helping. They might have, they have their medical home, then they might have a home visitor that is visiting with them. They might be enrolled in other services, right? And so we heard a common theme that they just didn't feel like they were, communities weren't feeling connected. And this was both from professionals that we've heard this from, but also community members. They just felt like their own providers and services just weren't connected or weren't on the same page with one another. Some of the community experience that we've heard with this theme was a feeling of competitiveness for funding. Specifically, collaboration is not incentivized. And there was difficulty collaborating across states. We've heard this one particular when we were down in the St. Louis area. So between East St. Louis and St. Louis, that's kind of where we heard this lived experience come from. Also difficulty identifying available resources. Yeah, we kind of heard that there, up in Chicago, and we know we have a few databases that where we can kind of, as providers, we can kind of search and find, actually even community members can have access to this. But for one example is the One Shy Fam that we have here in Chicago, where we can find providers and services based on zip code. And this is like a public search engine for folks. And so down in downstate Illinois, we've heard that there was just difficulty finding those available resources by zip code. And then the next thing we've heard was patient education. So around this, patients often felt unaware of the services that were available to them. There was a lack of proper education about the importance of prenatal, preconception, and postpartum care. And organizations need more support with community outreach and building awareness of programs so that more families are connected to those resources. So this one kind of goes hand in hand with the one we just mentioned. A lot of the community experiences, folks felt that they were just, yes, again, unaware of those resources at their local health departments. Repeat parents don't think they need additional support. So they oftentimes said, you know, this is my third, fourth child. I've been doing this before and I've been fine and don't really feel like they need additional support or that extra education. There was also, we've heard that there's pressure from family members to not seek additional care. Oftentimes we've heard this from, you know, oh, my grandma had this when she was younger and she kind of educated me on, you know, how to get through it, or, you know, she gave me advice, so I'm just listening to her instead of seeking medical attention. We've also heard patients and clients are not attending visits due to not knowing why or when they need to receive care. And medicalized language leave patients unaware of what is normal and proper timing of care. We heard a lot of examples around preeclampsia in pregnancy and postpartum. So there were a lot of experience of folks just not knowing what to do or what signs and symptoms to look out for. And the other big thing that we heard was housing. So there is generally a lack of affordable and accessible housing for families, and existing resources do not meet the demand. So we heard of extensive long wait lists and just like not hearing up or not having follow-up with some like housing applications. A lot of the times too, we heard that there's change and unclear eligibility requirements. So folks oftentimes don't know if they'd be able to qualify for housing, if they're overqualified, or what requirements they would need to apply for housing. But generally, you know, just the lack of is what we heard in most communities around the state. And then the other theme, childcare, this one was also really big too. Folks felt that there's just very limited childcare options and non-existent emergency childcare, right? So folks that either have to go and deliver or have like a medical, you know, medical appointments. There's just very, very limited childcare for families. Oftentimes, and I know it's not on here, but we definitely heard it was childcare is just really expensive and they're not able to afford it. There's not affordable childcare. They might not also have family support in their communities, so they're not able to leave the children with family members or friends. So just like a lack of like, or I'm sorry, a feeling of like isolation when it comes to needing support. And so this often resulted in families missing their appointments and or bringing their children with them to the doctor's appointments. And thus when they do, they often felt The doctors were being judgmental when kids were in their appointments. Also, patients checked themselves out of the hospital using an against medical advice, an AMA form, due to lack of childcare. So those were the two lived experience that we've heard most throughout. And transportation, I would say this one also is a really, really big one that we've heard consistently throughout our listening sessions. Distance to their providers, to their hospitals, especially in rural areas, was exceptionally like a big problem. And those that provide or that were needing high risk services also found themselves with issues and barriers. And this really just hindered their prenatal care and receiving it in a timely manner. This was exacerbated by the lack of transportation options available for families and the unaffordability of the car seats. So the lived experiences that we heard around transportation were just unreliable non-emergency transportation services from their MCOs, and lack of cross-state transportation agreements. So again, we heard this one generally in downstate Illinois. And then mental health. I will say this one too, right? Because we did ask during our listening sessions, we did ask a lot of questions around not just around their experiences with the healthcare systems, but their experiencing accessing services to mental health and substance use disorders. So folks around this theme, folks generally did not seek mental health services. And this was due to stigma, both culturally and systemic. They also had a fear of punitive measures. So either having, CPS or DCFS called on them. They might have felt judged that they weren't equipped to be a parent. And so they just, did not want to seek additional support. And this was usually caused by that distrust in the state. Also, there's long wait times for seeking mental health support and overall lack of availability of mental health providers that accept their insurance, specifically Medicaid. Providers did express that there is a poor care coordination, which leads to an inability to connect with their patients with mental health conditions, and connecting them with services. Again, they were fearful of punitive systems. Patients weren't feeling safe, to be honest, about their mental health and substance use. Also, male partners did not encourage them to receive, male partners weren't encouraged to receive the support that they needed. And providers did not explain what a mental health referral was for. That was also one that we've heard pretty common. And again, I think it goes back to that patient education, just not being thorough enough and explaining things thoroughly for their patients. Cultural factors put pressure on birthing person to be strong and not seek help. And more warm handoffs needed across organizations and systems was also a theme that we heard from folks. So again, that connection, bringing providers together, knowing of one another and their services to be able to do those warm handoffs. And this was actually a quote from one of our attendees at our listening session. So they're down from the Springfield area, and they said, "We lack coordination between service providers and clients. The system has not established trust with clients, and there are multiple entities telling clients multiple things. This has caused confusion and a lack of trust, and clients must prove they are entitled to services that they are receiving." So again, I want to reiterate too, listening sessions was really about folks coming together and sharing their experiences, sharing what it's like in their different communities when it comes to these different services. And I'll actually turn it over now to Haley, who will lead us through some proposed solutions from the groups that we chatted with.
Thank you so much, Elizabeth, and welcome everybody. So I will go ahead and go through the last page of the listening session summary for those who have the document. I did put it in the chat if anybody wanted to follow along. And then, of course, we'll send that out afterward via email. But essentially, sorry, Elizabeth, can you go back one more slide? Thank you. So essentially, once we collected all this information, we wanted to just didn't want to have a situation where we were just collecting all of this input from our community members, all of these providers and participants, and then not having some concrete solutions on how to move forward with that information. And so we did build in some questions into the listening sessions regarding, you know, in an ideal world, how would this barrier be resolved, or what do you need for yourself to be able to access this type of care and kind of work through these barriers, or what would it look like if these barriers weren't here? How would that affect your care? And so we really wanted to highlight that, just highlighting that our community members and the providers who are within these spaces and working within these systems know what's best for themselves and their communities in order to really effectively address these barriers. So we wanted to make sure that we were elevating their voices and what they need for themselves as they are experts on what's going on within their own communities. And so we decided to collect all of these recommendations directly from our participants and separate them within the listening session document to be categorized by different audiences. So with the intention with that would be to, for those of us who are within the maternal and child health space, whether we're social service providers, clinical providers, those of us who are public health professionals, or maybe doulas, or those who are in policy, can really take a look at that last page and identify where they fit in within those solutions and see what their role is and be able to use that to improve upon the systems that they're a part of. So go ahead to the next slide. So the first recommendation was system improvement. So those who are within the maternal and child health broader systems, whether that's like the government system, city systems, county systems, even national systems. One of the first things that we identified was an increase for funding, specifically for evidence-based solutions for all different social drivers of health. So not just maternal infant health, but also things around home visiting programs, childcare, transportation, housing. As Elizabeth mentioned, a lot of those services, if they were available at all, it was a little bit few and far between, or they had really long wait lists. Or kind of really impossible ways on how to apply for those. And so the services were very limited, again, if at all they were available. The second one that we had kind of heard frequently was this piece around improving collaboration between different organizations and systems. So state and health departments, hospital systems, and social service organizations. We identified one of the solutions that we heard was just trying to find a systematic way to really incentivize collaboration between orgs. We had heard a lot from partners that there was this like competition for funding. And so therefore they didn't necessarily always work with other community-based organizations because they were afraid of losing a certain quota for their the number of clients that they needed to be able to maintain to continue to receive funding. And so those types of barriers at the funding level really kind of like penalize community-based organizations from collaboration, especially in central and downstate Illinois. A lot of the organizations we talked to actually weren't aware of other organizations that were doing similar work, even if they were within their own county. And so wanting to really decrease those silos so that families can have all of the options available to them and not feel like that they have to have the pressure on them to kind of seek out all of these services, but all of these different providers, health departments and hospital systems are talking with each other. And then again, addressing just the competitive nature of grants and funding. So hopefully in an ideal world, we wouldn't have, you know, funding opportunities that are based on competition or the number of clients that you have to meet in like a quota sense, that we can just have sustainable funding for all organizations across all different focus areas across the maternal and child health systems. And then as far as the healthcare and hospital systems specifically, we heard from a lot of doula organizations, especially at the hospital setting, just them sharing their experiences being a doula, and not having like their clients' birth plans respected, feeling like not welcome as part of the healthcare team, kind of getting like out of the loop with their own clients and what's going on within the delivery space. And so just really encouraging hospitals to better integrate doulas into their healthcare system, adding them to that healthcare team, making them know that they're just as important and as perhaps the OBGYN or the nurse practitioners as a holistic like collaborative when it comes to delivering your child, and making sure that they're supported. So making sure that they're in communication with all the different healthcare providers on the team, and that their value is really prioritized. A second one would be increasing telehealth access options. So especially those who are in rural areas, it seemed like that there was a lack of telehealth options, or those options were starting to decrease. So just identifying ways to improve upon those telehealth systems already, and then increase the amount of available telehealth options for community members. And then lastly, building harm reduction approaches into hospital policies and systems. So I just wanted to give like a really quick quote from one of our participants. They said that there was really no conversations around harm reduction. They really don't know where the resources are relating to harm reduction. Participants and clients don't trust the system. They feel like that there's punitiveness at different levels, and therefore moms don't really want to admit that they're struggling. They pretend like they have to be okay. And then a really big part of that is like generational trauma from these systems that are not really addressed. And so just trying to build in those harm reduction approaches to have a more patient-centered approach to healthcare, and really checking those biases at the door. And then for those who are healthcare providers, a lot of the recommendations that we heard from participants was around training, again, integrating doulas a little bit better into the case management and the nurse team, to kind of tap them in to help support with providing patient education, incorporating not just like trainings for providers around racial bias, but making sure that those bias trainings are actually incorporating the living experiences of those who are pregnant and postpartum. We heard a lot of stories around birth trauma, a lot of stories of folks who were forced into medical interventions against their best wishes or against their consent, not feeling like they had full consent to those procedures. And so making sure that those experiences are highlighted while those trainings are being provided, to kind of drive home the importance of these trainings, so it doesn't feel as didactic. And then thirdly, providing intentional, non-judgmental, open door approaches to care. Again, that really does come from like the harm reduction standpoint. So making sure that families don't feel like that they're going to be unnecessarily reported on, making sure that the hospital space, whether that's the prenatal appointment, the delivery, or the postpartum appointments, are really a safe space for patients to be able to ask any questions that they might have, being able to share their needs without feeling judged or like rushed through their appointment. Some patients had described that they are just kind of like handed some papers by their providers and then not really explained what the papers are for. And so it kind of de-incentivizes them from following up or making that extra appointment. Another one was developing individual birth plans with clients who are going to be delivering at your hospitals, and also in collaboration with doulas. So making sure that those birth plans are developed as a team and respected during childbirth, regardless of individual medical bias or individual provider bias. And then finally, for healthcare providers, just creating a family-centered approach for the appointment experience. As Elizabeth mentioned, some of the clients felt like that they were judged for bringing their other children to their appointments. They felt judged if they didn't have like the father of the child at the appointment, if they were perceived as being a single mother. So just having a more like open approach to different types of families that providers might see, and making sure that all those different types of family dynamics are respected. And really those experiences are centered when it comes to providing really holistic healthcare. I wanted to highlight one idea that we heard from a St. Louis hospital. They do have a policy that's called Commit to Sit. And so within that policy, the nurses are have a priority of sitting with the patients for longer than the 15 minutes that they're usually allowed, to really better connect with them and kind of have their appointments be more of a conversation than just an appointment where they're just being thrown information and don't feel like they've got time to address all of their concerns. And then for those who work with health insurance plans, definitely improvements to non-emergency medical transportation that MCOs offer. I did see in the chat there is most MCOs do offer transportation for folks who are have appointments that are non-emergency appointments. But so much of what we heard was that they some clients were like maybe ghosted by that transportation service. They weren't like allowed to bring like other children with them. They like didn't show up on time, or they did show up and then told the client that they were at the door, but then when the client was walking out the house, they were told they're waiting too long, and so they left. And so even though those services do exist, they are historically a little bit unreliable. Just hearing from those experiences from the participants. And so having improvements to those different services would be would improve the access to healthcare that folks really need, especially for rural counties. And then lastly, for health insurance plans, just coordinating better with neighboring states to ensure that there is that collaboration across MCOs across state lines. So we had heard that for Illinois folks who have MCO plans, that those transportation services don't allow them to like go to appointments in St. Louis on the Missouri side. But Missouri MCOs do allow transportation to like Illinois hospitals and appointments. And so there was just a disconnect between those two different states and those two different MCOs that really prevent folks from receiving the care that they need. And then the last recommendation that we identified was around community-based organizations. So really developing a comprehensive care coordination systems, especially in rural areas. So being able to have different community-based organizations have a system of being able to collaborate with each other, being able to talk with each other without fear of losing clients. Just wanted to read one of the quotes that we had heard from our one of our participants. So just them saying that authenticity is super valuable, incorporating members of the community, and then turning them into sort of like ambassadors for these resources. So those who are within the community who know of these different community-based organizations, that they can kind of assist with like developing these care coordination systems for their own communities, and further like decrease some of those system silos that we see. And then secondly, building a comprehensive statewide, either statewide, countywide, or community-wide directory to kind of serve as a one-stop shop for connecting social service organizations and then streamline those closed loop referral processes. I know here in Chicago, we do have a few different platforms like that. I think Find Help is one of those. Also Unite Us, formerly NowPow, is one of those platforms. So just encouraging community-based organizations to kind of look into perhaps like some more third-party platforms to streamline some of those services and have a one-stop shop for all either clients, providers, or community-based organizations to be able to look up by zip code what's available in their area. And then lastly, this was an idea that came out of our Chicago listening session, but providing individuals within the community the capacity to create their own systems of care. So for example, like a health hub for the purpose of centering their specific community health needs, sharing resources, and then dismantling system power dynamics. So some of that conversation looked like, if we have let's say like a trusted elder in a neighborhood that people know to go to for food or to stay if they don't have anywhere to go, like why wouldn't that particular community member be also set up to be like a community health hub for their area, especially if there is a big distrust within the community with other organizations. And so thinking about community-based organizations working more closely with community members to provide that capacity for them to be able to share and educate their other folks within the community, just the different services, health information, education. And I wanted to really highlight, this is my favorite quote that we heard from our listening sessions, just relating to this idea of building community member capacity to be more of a health hub. Of the system is not built to support us, so what is the alternative? Um, and with that, I will go ahead and pass it back over, um, I think to Tam or Elizabeth to go ahead and close us out and talk more about our EverThrive programming.
Thank you, Haley. Yes, so kind of the next, kind of where we are, after we concluded the wrap up of the listening sessions, we kind of wanted to also share like what our work, how this has really shaped our work since then, and some of the programming that we've done. As you've heard, a lot of the themes that we've heard were centered around mental health, the social drivers of health, right? Housing, transportation, and then also substance use, disorders and just like accessing services and help and support. So one of the ways that this has actually shaped our work is through the provider workshop series. Many of you may have heard of this, and so this is a 3-part training series that we divvied up into 3 different modules. The first one being centered around maternal mortality 101, really giving providers, and I should mention, this workshop series is centered for both medical and social service providers. And it's really to for them to gain some insight on some of the feedback that we've been hearing across the state, and then just providing just general education around maternal health outcomes in relation to these different categories. So again, the first one is a module on maternal mortality 101, and we did give a lot of statistics around maternal health outcomes across the state, specifically centered around central and downstate Illinois. So this first cohort that we hosted in December through April was focused on providers down in central Illinois and downstate Illinois. The second module was around the social drivers of health. So that included housing, transportation, access to healthcare, access to insurance, things like that. And the last module wrapped up with some mental health conditions and substance use disorders. So again, giving just a general background on these things, but also giving data across Illinois. And that data was pulled from the IDPH maternal mortality and morbidity report that was released in October of 2023. And so we really highlighted a lot of the data in a lot of these rural counties. And I also want to share too, we are planning to host a second cohort in FY26, specifically with a focus on having providers from the Edwardsville region attend that cohort. That is an area of the state that we want to target and get more providers input and partner with them a lot more this coming year. So if you know of any hospital systems, clinics, CBOs that would be interested in having a team of theirs, join this cohort, please reach out to me and just, let me know. I will be, reaching out to a lot of you to see if you know of anyone. But yeah, so again, the general goal of the workshop series was to bring awareness to a lot of these issues issues and barriers that we heard from folks in these communities, with just that focus on Central and Downstate Illinois. And again, to like bring providers together, and increase their collaboration amongst one another. And then I'll actually just pass it over to Tam to chat a little bit about the community chats.
Thank you so much, Elizabeth. And I think we've already got an opportunity to reach out to some folks in the Edwardsville area. Thank you, Connie, for jumping
Awesome.
in there. So thank you so much for that support. So again, a part of our programming was to ensure that we not only are working with our providers, but also with our families who have barriers that come from, again, not being heard. And this is leading to discouragement. And again, our maternal mortality crisis being 3 times the rate as others in our community. A lot of this is very preventable. And what we found out, not only through our listening sessions and focus groups, but also providers, is that this barrier is not because of foreign language, but because of comprehending what you said is not what I said. And I love to always bring up the fact that you don't know what you don't know. And if I used to, as a mother of 6 myself, and being able to just go out and be able to talk to a provider and say, hey, sugar runs through my family. Some of us know that to be diabetes, but for those who do not recognize that term, it could be a barrier right to a conversation, and literally could be the difference between getting adequate or inadequate care. So one of the ways that we wanted to respond to community was to set up a community chat. And again, this is to increase the community's understanding of what the maternal mortality crisis is and the factors contributing to that crisis, right? We want them to know what postpartum warning signs look like. We want them to think about their perinatal, their maternal mental health, right? And then really think about, how do we increase community connectiveness? So again, we have folks who are sitting in, as you've heard, because of that historic barrier of trust, people are sitting within their homes that are not responding, or have folks who can support responding when they find themselves in these crises. I heard a lot during that time, like people say, well, just go lay down, it'll get better. Or maybe it's just having a setback, slow down. But again, we have to ensure that we are educating community so that they can be aware. And what we really loved about this is, a part of this particular presentation is not focusing just on the mom, but to make sure that we're focusing on, who's your tribe? Who are the folks who can, if something happens to you, can be an advocate for you? And that was really important when we started thinking about going within the community, right? And putting the onus not just on this top-down approach where providers are giving this information, but how do we educate folks to be able to show up and to really be able to not feel like they'll be dismissed. And so we have an opportunity to share with them about, like, really, what can you say? What can your family members say? What can grandma say if something happens? What to the father of the child, right? Or your companion, what can they say to advocate on your behalf? They need to be able to say, hey, this person just had a baby within the last year. So those are the type of things that we wanted to ensure that we are sharing with families. Because again, this disconnect that we're seeing and not being able to feel like you're in a trusted space. Most of us always need, I used to say this all the time, where my ride or die at, right? Or this person that, will be there for me, right? Got my back. And so this is our opportunity to go into the community and really show them how to do that. And so it's really been a great opportunity for us to do that. We've currently hosted in the Austin community. Don't forget about your libraries, North Lawndale, Oak Park. And our last chat is scheduled in the East St. Louis area with the Doula Lab on June 21st. So really excited Again, we are trying to make sure that language and understanding these medical terms are really across the board, and we get a chance to center, again, language doesn't have to be a barrier. Trust should not be a barrier, but how do we build components of care within your own group, your families, your community, and how do you connect folks together? So again, having that trusted person to help you sort of navigate, ensuring that you know the barriers and the signs. Nobody should be telling you just to lay down, all right? And so again, really ensuring that you know your body best. These are the things you should look out for. And again, no one has to say, this person that I love didn't come home after they had the baby, or they died within 1 year of having their child, or that the depression is something that can be glossed over. And, you know, often we always hear everybody wants to hold the baby. Who holds the mom? And so for us, it's really important that we uplift that in our community chats. Next slide, please.
Thank you so much, Tam.
Thank you.
Yeah. Well, yeah, now we want to hear from you all. If anyone has any questions, I know you guys have been sharing some comments and feedback in the chat, and we appreciate it. But kind of wanted to give, since time allows, just some time to just open it up to anyone on the line. I know, oh, we see a hand raised. So yeah, just for any questions, comments, feedback, we'd love to hear from you all. Brenda?
Hey, hi, Tamala. I just want to say that as a community reproductive justice advocate, I feel affirmed because this is what I hear from our communities. I feel heard, I feel seen, I feel loved by you all. Thank you for sharing the data. That's what we should all be doing when we get surveys from our communities. We should present it back to our communities. I love how you're doing community chats. I agree with you, ditto, 100%. It is community support, and we rely on our neighbors, our aunties, our grandmothers, our mamas, our elders. We rely on one another to take care of one another. And we cannot continue to work in silos just with the birthing parent, but we have to work with her support system and engage them in this dialogue and meet people where they're at. So I just want to say kudos, congratulations on the amazing work and for presenting this. And again, feel really affirmed and heard and valued. So thank you.
I love you, Brenda.
I love you too, Tamala.
Thank you for joining us. And I'm glad that that's what this is all about. It's nobody should ever feel alone. And we really want the community that supports those families to know that and know that we are just building more than just resources. We're navigating them with them, right? And so that's all very important. And congrats, Alicia. Can't wait to join the doula lab later this month. Other questions, Elizabeth, that we have? Or anybody want to come off mute and just, we have about 11 minutes.
I don't think I saw any in the chat, but okay, so we do have a question. Sorry, I don't know if we've already answered it. So we have a question. Hello, how can new members participate in the community chats? Are community partners welcome to participate, or is it only for families?
One of the things that we really wanted to do was have more of that kitchen table feel, is what I would like to refer to it. So the community chats are a lot more about people recognizing what amongst each other. What we have tried to do is to have folks at some time be vendors. So we're wrapping up the piloted part of this, but as we think about how to, again, for this upcoming year, how we can integrate more of that feeling into it, right? Because providers are providers, right? But again, we want the folks from the community that can share information amongst each other, and then maybe having a small group of folks who are vendors who can provide a resource to the families, because really that's what it's all about, to have that tangible go-to person from organizations that we're working with to do that. So again, we are thinking about our next set of ways in which to encourage all of us to be a part of that. But again, we're really recognizing that for our families, they like it to be a little bit more intimate. They want to feel like it's an open and safe space. So not taking you guys out of as community-based organizations, you're definitely involved, but you are the folks that we send the resources to, right? We want to be that warm handoff that we see that is lacked often when it comes to providing referrals for our families. So that's how we've looked at it thus far. But again, we are thinking about how to incorporate more of this work with our community-based partners as we maintain and build those. So more to come, but I'm excited that you even want to be a part of the chat. So thank you for that.
We've also had someone say that they believe if we discuss these issues with the alderman, senator, and invite families to voice their concerns. We've also had someone, Brenda asked, how can we promote community chats?
Again, more to come as we wrap up this year. And a part of what we've done with our listening sessions is we took all that feedback and we recognized, right, that we had to go like boots on the ground, get in there and start talking to families specifically. So when we start thinking about how we expand that, I'll be really, really open to those of you who have expressed interest in helping us with that. So thank you.
We've also had someone, so April, who is a mental health professional here in Chicago, has also shared that this was very informative and one of the intimate experiences of participants as a community organization provider, helpful in shaping the continued work and support around mental health support. So I know you do a lot of work around mental health. But yeah, does anyone else have anything they'd love to share with the group? Any other input or feedback, questions? Oh, you won't receive a certificate for joining today, but you will have, the recording of this webinar will be sent out to everyone that registered. It'll also be posted on our YouTube page. In addition, for those that registered, you will have a copy of the slides. So you have this information along with a copy of our one-pager that we created.
Yes, that one pager is really important, as we have saw a few of our partners have also started incorporating some of the themes that surrounded our dissemination of our efforts. So exciting. Okay, April, I'm putting you down. You're going to be volatile, okay? Is that okay?
Awesome. All right, if no one has any other questions, I'm just gonna close this out here. Just share some, oh, we actually have one last question. How can you sign up for the doula lab?
So the event is happening at Belleville West High School, again, June 21st. So again, I will send out it's also being shared through the doula lab. So I can definitely send a flyer if you're in that community area for you to register if you'd like to attend.
And then sharing some, closing us out with some of our EverThrive resources for you all to share with your clients as you see fit, and also just to have as a resource in your toolkit. Like Tam mentioned, the Gathering campaign. We did put a QR code here to take you directly to the landing page. But yes, the Gathering campaign. Tam, did you want to give like a brief 10-second intro of this as we wrap up?
Absolutely. Again, as we mentioned earlier, this is our digital campaign that again came out of our focus groups that were held within the community, and it has everything that you need to help advocate not only for yourself, but for those who can support you. So we talk about before you have your baby, after you give birth. Recently, we added the mental health component and also friends and family. We have scripts available to help folks know how to do this, and how not to be scared, to be an advocate for oneself, to also recognize that you are not alone, that there are places and things that you can do that are very supportive, and glossary of terms. I can't uplift this enough. We really want providers to go in there. You have PDFs of which you can get to families as well. But again, about the barriers to language, what we hear, the medical terminology versus community nuances or the language that's used within community, and how we can bridge the gap between the two. But again, this is our digital resource. Please either take a picture of the QR code or go to our website. Look up The Gathering, and again, there's a ton of information, but again, it's our campaign. We have boots on the ground. We've integrated this into our community chats and other opportunities, our workshop series. It is there for you. And if, again, you have any questions or concerns or want more information, feel free to reach out to us. Thank you so much.
Thank you, Tam. I'm also linking a QR code here to take you if you wanted to sign up. So our policy and advocacy has a policy action network. So you can sign up to receive news and information and join that network. Right. Our policy team is educating us. They're mobilizing a lot of the work, and also to be able to tell stories. So they oftentimes want to hear a lot of the stories that we're hearing from families when it comes to, yeah, just like their experiences, either with healthcare systems, insurance, things like that. So please, if you're interested as provider, please sign up for our Policy Action Network. And yeah, and then these are all our social medias. Feel free to connect with us on there. And that is our website there, everthriveil.org. And I want to just say thank you to my colleagues, Tam and Haley, for working on this project for over a year and a half now. And I want to thank you all as well for attending this webinar.
And I say kudos. Thank you all for joining us. It's really important that we are sharing this information. And again, we appreciate all of the support you all provide, and looking forward to a beautiful summer if it ever gets out the chokehold from the spring. And looking forward to next year and opportunities to work with you all.
All right. Thank you so much, everyone. Have a good rest of your day.